One thing we need to remember when our patients come into the center here, that our patients come to us with many more problems than just a cancer diagnosis. They have multiple other issues that are going on in their lives that need to be paid attention to. And if you don't pay attention to those issues, then the care itself will be diminished. Sometimes they don't get the care because they opt out of it because of all of the other stressors that are going on in their lives. And so here in the Cancer Center, we try to pay attention to those issues, listen to what the patient's needs are, and if there are things that we can assist the patient with, then we help navigate that for the patient so that they can focus their care on the cancer treatments rather than all of those other problems that they have in their lives. Unfortunately, our insurance role is extremely complex, and patients don't know, what kind of programs and what kind of insurance coverage instruments are out there, and that's where the navigation comes into play, where they can educate the patient about what's available for them. We have multiple different levels of staff here that address specific areas. So we have individuals that will address the nutritional needs of the patient, the emotional, psychosocial needs, the spiritual needs, and the financial needs as well. And so we all specialize in those different areas. Patients, when they come to us, if those issues are identified as being an issue, then we are referred to, and then we will help navigate those patients through that process. It provides a level of comfort for them. It provides a level of relief. I have story after story that I can share with you. Our patients come in here with these stressors, and if we've been able to alleviate those, that the patient, their experience here is just so much better. I can tell you a story of a lady that came in here who was underinsured with her insurance policy, and there was a specific intervention. I could navigate her down a specific path where she had better insurance coverage. She wasn't aware of that this was available to her. So I'm meeting with her and guiding her through this whole process, and at the end of the intervention, she responds, "Thank you," or that's what she says to me, and I go, "You're welcome," and I'm walking out the door, and she yells again, "Thank you," and I stop and I acknowledge again, "You're welcome. It was a privilege to help you with this situation." I'm leaving for a third time, and she yells out again, "Thank you." This time when I turn around, there's tears coming down her eyes, and I walk over to her and hug her and say, "You're welcome. I'm glad that I was able to fix this issue for you." And I'm leaving for a fourth time, and she grabs my arm, pulls me back, and says, "You don't get it, Dan." And I said, "What is it that I don't get? Help me understand." And she said, "Before you walked into this room, I had been told about all of the treatments that I need, and I knew I couldn't afford it. My insurance wasn't going to cover it well, and so I was planning my funeral before you walked into the room. Now that you showed me what kind of coverage I can get and that it's available to me, I'm planning to get treatment." Sometimes our focus is on the specific treatment that they're receiving when there's a lot of other issues going on. And so if the patient seems anxious, we should ask, how are they doing, and then make the appropriate referrals to the appropriate staff.